Right now, there's a good chance you're watching this video because you're in pain. Maybe you can't sit through a meeting without shifting constantly. Maybe getting out of bed this morning felt impossible. Or maybe you're scared because you felt your leg give out on you and you don't know if it's going to happen again. You've probably typed something like, "Why does my leg hurt when I walk?" or "shooting pain down leg" into Google. And now you're here trying to figure out what's wrong and if it's ever going to get better. I'm Dr. Megan Tomberlin from Waves of Wellness Chiropractic in Leland, North Carolina. I work with people dealing with sciatic pain every single day, and I'm going to answer the real questions you're searching for right now. Why does my sciatica hurt more when I sit? This is one of the most frustrating questions we hear. When you sit, especially for long periods, you increase pressure on your piriformis muscle and the sciatic nerve. Think of it like pinching a garden hose. The longer you sit, especially with poor posture, the more compressed that nerve becomes. Standing up and moving around helps release that pressure temporarily, but the underlying issue needs to be addressed. Can sciatica cause pain in both legs at the same time? While sciatica typically affects one leg, bilateral sciatica affecting both legs can happen. This is less common and often indicates a more serious condition like spinal stenosis or a central disc herniation. If you're experiencing pain, numbness, or weakness in both legs, especially with bladder or bowel changes, you should seek immediate medical attention. Is the pain in my calf actually sciatica? Yes, it absolutely can be. Sciatica doesn't just stay in your lower back. The sciatic nerve runs from your lower back, through your buttocks, down the back of your thigh, and all the way to your calf and foot. Many people are surprised to learn that their calf pain, burning sensation, or even cramping could be coming from nerve compression in their lower back, not a muscle problem in their leg. Why does my foot feel numb or tingle with sciatica? Numbness and tingling are classic signs that your sciatic nerve is being compressed or irritated. The sciatic nerve carries sensory information from your leg and foot back to your brain. When that nerve is pinched, those signals get disrupted, causing that pins and needles sensation or complete numbness. This is your body's way of telling you something needs attention. Can sciatica get worse at night? Many people notice their sciatica pain intensifies at night, and there are a few reasons why. First, when you lie down, depending on your sleeping position, you might be putting more pressure on the affected nerve. Second, inflammation tends to increase when you're inactive for long periods. And third, during the day, you're distracted by activities, but at night, you're more aware of the pain. The good news is that proper positioning and treatment can significantly improve your sleep. How long does sciatica usually last without treatment? This varies widely from person to person. Some people experience relief within a few weeks, while others deal with symptoms for months or even longer. Here's the thing though, waiting it out isn't always the best strategy. Without addressing the root cause, whether it's a herniated disc, piriformis syndrome, or spinal misalignment, you risk the condition becoming chronic or worsening over time. Early intervention typically leads to faster recovery. Will losing weight help my sciatica? Weight can definitely be a contributing factor, but it's not the whole story. Extra weight, especially around your midsection, can increase stress on your lower back and contribute to nerve compression. However, I've seen plenty of people at healthy weights with sciatica, and plenty of people carrying extra weight without it. The key is addressing the specific biomechanical issues causing your sciatic nerve irritation. Weight management can be part of the solution, but it's rarely the only answer. Is surgery my only option for severe sciatica? Not at all. While surgery is sometimes necessary in extreme cases, the vast majority of sciatica patients respond well to conservative care. I specialize in dry needling to reduce muscle tension and inflammation that compresses your nerve. Dr. Jordan also offers active release technique to release soft tissue restrictions. We've helped countless patients avoid surgery by addressing the underlying cause through targeted, non-invasive treatments. Can stress make sciatica worse? Absolutely. Stress causes muscle tension, especially in your lower back and hips. When these muscles tighten up, they can put additional pressure on your sciatic nerve. Stress also increases inflammation throughout your body and can alter how you perceive pain. Many of my patients notice their symptoms flare up during particularly stressful periods. Managing stress through proper care, movement, and relaxation techniques can be an important part of your recovery. What's the difference between sciatica and piriformis syndrome? Great question. Piriformis syndrome occurs when the piriformis muscle in your buttocks compresses the sciatic nerve, causing similar symptoms to sciatica from a disc problem. The pain pattern can feel identical, but the treatment approach is different. This is why proper diagnosis is so important. Through physical examination and movement testing, I can determine exactly where your nerve compression is occurring and create a targeted treatment plan. If you're dealing with sciatic pain, numbness, or tingling, you don't have to suffer through it. At Waves of Wellness Chiropractic, Dr. Jordan and I are here to help you get back to the activities you love. Whether you need dry needling, active release technique, or a comprehensive treatment plan, we'll work with you to address the root cause of your pain. We serve Leland and the surrounding areas. Call us today at 9108-598-359 to book your first appointment. Let's get you moving pain-free again.